So we get a lot of questions about injections. You talked about it a little bit there. Let's just go over that. Patients will ask me, well, what are the negative side effects of injections? Is it going to hurt? If we stick a needle into your body, it's probably going to hurt you a little bit. The positive side effects, hopefully, is it gets rid of the pain. But what are some negative side effects? And talk a little bit more about um, the patient population that you choose in terms of, okay, this is going on in the shoulder or the knee. I think you're going to respond better to a steroid, or you're going to respond better to PRP or stem cell, or is it like a progression of, well, let's try the steroid first, and if that doesn't work, then go to the PRP, or what's the decision-making process?
Absolutely. Now, when it comes to trying to decide, first, let's start with complications. Now, here's what I always tell patients, and if you are not thinking about complications when you walk into a doctor's office, you're entrusting that the physician will do what's right for you, and I think that's a good approach. But I always tell patients that everything we offer in medicine is like poison, and it's kind of like a question of recognizing and understanding it. And it goes back to what we do every day. If you eat too much, you gain weight. If you drink too much, it can hurt the liver. If you take too much ibuprofen, it can literally hurt your kidneys. If you take too much Tylenol, it can hurt the liver. So too much of everything is bad. That's the pattern. And the same thing applies to injections. When steroids are inappropriately utilized, for example, if a dose of steroid that is administered to a patient is not monitored, yes, it would result to a lot of side effects, such as weakening of the bone, the joint, the ligament, and that could be a serious problem. Say, for example, you can see it in patients with osteoporosis where the bones are weakened. Now, again, it's very critical to be very careful to say steroid is the cause. It is inappropriate use of the medication that can result to some of the side effects that we see in patients. The other thing I always tell patients is it comes down to think about your provider or your pain doctor as a chef. And if your pain doctor is a good chef, you're going to expect that he cooks the best meal and you're going to go back for dinner one day or another day or a couple months from now. But the reason why I say that is that, it's very important to recognize and actually ask questions to your pain physician, because the technical knowledge and skill set is critical, because with appropriate understanding, you can minimize a lot of the complication and most likely eliminate most of the complication that comes with doing the procedure, which can vary from numbness, tingling. But again, these complication rates they're less than 1% in the space, and even less than 0.08% in a few instances. So that's what I would have to say with the complications. Now, moving to the use of regenerative medicine versus steroid, that's a fascinating topic, extremely fascinating, and we can spend hours talking about it. And the reason why I say that is because the body has an inherent capacity to heal itself, and it's so powerful. What PRP means, platelet-rich plasma, is the idea that you are isolating parts of your body, parts of your blood, I apologize, that actually is responsible for healing. You're concentrating that amount and you're putting it in a body part that requires more aggressive healing. Now, one of the things I tell patients is like it's almost like when you cut your hair, it grows back. One of the reasons why it grows back is that there are a bunch of cells that make it to that location to actually see the hair grow back. PRP is very similar in the sense that you have accumulation of regenerative cells that if you pull them together and put them in a location that requires regeneration, you can actually help that body part regenerate. Now, there's several forms of regenerative formulas that people may have heard out there. There's PRP, and sometimes there's PRP added to alpha 2 microglobulin. There's even like harvesting the marrow itself. The bone marrow is kind of like I call it like the house and the foundation for all stem cells. You can harvest the bone marrow, spin it, isolate the bone marrow, and the concentrate from the bone marrow can also be used to be applied to like joint spaces, that can help with healing. Now, deciding whether you want to go with regenerative medicine versus a steroidal approach, it becomes a very, very dense but also controversial question. But I always tell patients it comes down to your what your objectives are, what your goals are. So if you're in so much pain and you want almost immediate relief, I will tell you, when you look at PRP versus steroids, PRP takes a little bit more time for you to get that relief that you're looking for. It comes with structural component, but it takes time versus steroids. You may even have relief right away or even in 2 weeks. So again, there is that part to really think about. Now, the other thing that decides whether you go with PRP or not, or steroids, really comes down to the nature of your injury. I will say that there are certain kinds of injury that I tell patients, it's probably not a good idea to spend a lot of money with regenerative medicine. And I'll give you an example is I've had multiple patients come up to me, partly because they're familiar with some of my work with stem cells, and they say, I have knee pain. I really want that PRP you published. And I look at it, I get an X-ray, and the knee is bone on bone. I'm like, it's already bone on bone. There's no cartilage to regenerate. At that point, I would discuss, use of maybe gel shots or even talking to a surgeon, because at that point you need a new knee. So the nature of the injury also determines whether you pursue PRP or regenerative medicine versus a steroid injection. We can talk for hours, but I'll leave it at that for now. I get really excited with regenerative medicine.
Yeah. Okay.